Okay, done. We are live now. Okay, so this is a live session. So this is being live streamed on our company's YouTube channel. So I'd just like to welcome everyone here. Okay, and done. We are live now. Thank you so much for joining us. So this is being live streamed on. And yes, so today the topic for today is oral health, men's oral health, and it will be conducted by Litesh. So Litesh, if you can just take over and if you can just introduce yourself and take over, that would be really good. Thank you.
Sure. Thanks, Bodhi. My name is Litesh. I work in a New South Wales campus here. I'm a course coordinator for vet courses. So today I have been given an opportunity to speak about oral health, specifically men's, because we are introducing the men's health and importance of men's health. So I have tried to put my knowledge together into 15 to 20 slides altogether, and then we'll go one by one. So like I said, today's topic is oral health. And why we choose on oral health? Because I was very comfortable speaking on oral health, and I feel like this is the most neglectable part in our male community. So again, what is oral health? So oral health is basically, it's a key indicator for overall health. So like you say, your smile is infectious. Same way, in smile, the teeth are most important thing. So when you smile, the first thing people notice is the teeth, how clean they are, how aligned they are, and then of course it goes to the breath part. So again, it's a key indicator of overall health, well-being, and quality of life. It causes a range of diseases and conditions that includes dental caries, most common ones, the holes in the teeth, periodontal disease, tooth loss, oral cancer, and few serious manifestations, which is HIV infection and oral dental tumor. And now why men needs to know more about oral health? Like same way, men are less likely than women to take care of physical health. And according to the surveys and study, the oral health is equally ignored. Like we are so busy in rushing things and finishing our job, going home, give time to family, or do whatever we like. But our health is always the last part we look after. So good oral health recently has been linked with longevity, and yet one of the most common factors associated with infrequent dental checkups is being male. So if you are a male, you are less likely to go for a dentist only for regular checkups. Of course, if there is a pain, you cannot sleep at night, you have to end up going it. But if we put things on the place from day one, you may not require dentist for rigorous procedures. So men are less likely than women to seek preventative dental care and often neglect their oral health for years, visiting a dentist only when the problem arises. Okay, so I have listed down few common causes or the problem the men have it and why they have it. So let's discuss the most common one. So mostly men will be doing the periodontal disease if they are on a medication and tobacco use and playing support. So why the periodontal disease is a problem? Like we have discussed before, men's are highly unlikely they will go to the dentist. When they will go to the dentist, when there is a huge problem happening. So if I am going to the dentist from day one, my oral health will be much safer position. But if I'm not going, I will be ending up, when I'll go, I will have my dental cavities, I will have loose tooth. So chances are periodontal disease is only a manifestation of late or chronic dental problems. So periodontal disease is a result of plaque. If I'm going to the dentist, my dentist will remove plaque from day one. So I don't have a periodontal disease. So what is a plaque? It is a hard and rough surface or a substance, it's a tartar. So if we check our incisors, the front lower incisors on the back of it, that's the most common area, we will find the tartar. So today, if you have a chance, when you before sleep, when you're brushing your teeth, just go and have a look. You will find what I was talking about. So the acid produced and released by bacteria found in the tartar, which irritates gum. So if we leave tartar for too long, that actually start irritating gum and recession happens. And these acids cause the breakdown of fibers that anchor the gum tightly to the tooth, creating a periodontal pocket. So if I leave my tartar for too long, acid will produce, it will slip going on between the tooth uh, and the socket, and that starts slowly starting damaging my tooth and result in the loosened tooth, and that's a periodontal. And that's why men have a common, because we don't look after, or we don't want to go and then do the cleaning part. So that will create a periodontal pockets that fill with even more bacteria. So researchers have shown a connection between gum diseases and cardiovascular diseases, which can be place the people at the risk of heart attack and stroke. So same with the plaque. Plaque is like a cholesterol thing. So it can, men can indigest it and it can always land up in one of the important artery and leads to stroke or even heart attack. So when do you know that you have a periodontal problem? So if you see there is too much bleeding happening when you're brushing, it could be swollen, red and tender gums and persistent bad breath, or loose or separating teeth. Now, always remember, loose and separating teeth is the last stage. But if you want to take it seriously, if you think it's bleeding gums happening, straight away book an appointment and then see the dentist. All dentists have to do is remove the tartar part, and then we are safe, or at least we are delaying the process. Now, another one is why men is more likely to have dental problem because of the medication. Since men are more likely to suffer heart attack, they are more likely to have a medication which cause dry mouth. I'm talking about blood pressure or antidepressants medications. So when you take too much of this medication, there is a chance that salivary gland have a blockage and they won't release much of saliva like normal human or normal male person has. So when there is a less saliva, when you eat food, there is a chances that food will start sticking on your teeth. When the food start with sticking on the teeth, they will produce the cavity because now there is no washing things happening. So if any one of us is taking blood pressure tablet or antidepressant, make sure we go and see the dentist regularly and get at least the cleaning part done. If not, then make sure we have enough water at place, or at least start doing our brushing or increase our brushing regime, probably after half an hour you take every meal. So saliva is very important. Saliva helps us to reduce the cavity which cause bacteria found in your mouth. And another one, tobacco again, why it's very common. So if we are using tobacco, again, we have a greater risk of gum disease and oral cancer because you're constantly putting a negative pressure on your mouth. And men are affected twice as effect as women, and 95 of the oral cancer occurs over 40 years of age if they are being regularly on nicotine use. And the most frequent oral cancer sites are tongue, floor of a mouth, soft palate tissues, in back of the tongue, lips and gums. And if it is not diagnosed and treated in early stage, it can really spread and leading to chronic pain, loss of function, irreplaceable facial and oral disfigurement following surgery, and even death. And nowadays, to have a common thing, if you go and buy the cigarette packet, you will see these pictures on the top just to scare you. So more than 8,000 people die each year from the oral and pharyngeal diseases. And if you use tobacco, it is very important to see your dentist frequently for the cleaning and ensure your mouth remains healthy all the time. So your general dentist can perform throughout the screening of oral cancer because they are the one, if they start seeing the white patching in your oral mucosa, they will be the first one to refer you to oral medicine person. Okay, now the last one is, do you play sports? So if we play sports, we're meant to be healthy. So then why I'm talking about dental thing here. If we participate in the sports, there is a greater potential that we may end up having trauma in our mouth and teeth. So if I play sports such as contact sport, football or soccer or basketball or even baseball, it's very important for me that I will be wearing a mouth guard. Otherwise, someone gonna kick me on my face and that's it. My sentence hazard is gone. So which is a flexible, again, appliance and made up of plastic and product. Even anyone can make it. If you don't have to go to dentist, you go to dental prosthetics and have it. Same way, if you ride bicycle or motorcycle, always wear helmet. Okay, now we talked about oral health, why it is important. Now we talked about what things can cause oral health, especially in men. Now I'm gonna talk about a little bit and touch a little bit on the specific. There are specific services in dentistry. Like we all know in our medical industry, there are specific, like if you have to go for your bones, you have to go for orthopedics. If you have to go for surgery, you have to go for general surgeon. If you have any small and general problem, you go to the GP. It's the same way in dentistry also. There are quite significant subdivisions. So which is the general family dentistry, endodontics, oral and maxillofacial surgery, oral medicine, orthodontics, periodontal therapies, or prosthodontics. Like in medicine, if you have to go for a specialization, you need a referral letter. Same way in dentistry. If you have to go for a specialization, you may be, the first point will be the general family dentistry. And from there, they will start, your dentist will start refer you if it is not in his hand or her hand. So let's talk about one by one. What is general family dentistry? It comprises and personalized dental care for entire family. You go there, they will do your regular examination, cleaning will happen, preventive treatments will happen, and the goal of development a comprehensive plan to resolve future dental issues can be managed in early stage. So you will be talking like normal filling, scaling, x-rays, um, chipping of the tooth, and little bit of detailed cleaning as well. And this is, like I said, this is the first stop. If you don't go there, the chances are you will end up, we talked about it, like periodontal problem. Now it's an endodontics, like a root canal. So everyone, I'm assuming everyone knows root canal. What happened is root canal, you delayed your teeth too much and the cavity goes all the way into the pulp and there is no way the journal filling can save your tooth. Now you have to see the specialist. Root canal can be done by normal dentists as well, but if root canal needs to be done in, let's say, third molar, you need to see the specialist. Or someone have done the root canal and you are not happy, you're still feeling pain, you may end up going to the endodontist. So re-root canaling is also very common. And that's where you have to see the endodontics and specialist. So specialist is also same thing. They will finish their Bachelor of Dental Surgery and after that, they need to have certain experience, 1 or 2 year experience. They will write the expression of interest in which stream they want to do. And after that, they will be end up doing it, let's say, for 2 years or 3 years. So it's quite rigorous process. So what does endodontics do is basically saving the natural tooth with root canal treatment, and it has many advantages. If you have another normal tooth, even if you have implant, you cannot put much force because something is natural and artificial is artificial. So if you have your own tooth, there will be effective chewing. There will be normal biting force and sensation, natural appearance, and protect other tooth from excessive wear and strain. Now, next stream is oral and maxillofacial surgery. In Australia, to become an oral and maxillofacial surgeon, you need to have MBBS, so you need to have medicine degree. On the top, you need to have BDS degree. So it's quite an time-consuming affair, but there are few doctors who are passionate about it and they have done it. So oral and maxillofacial surgery services using a wide variety of surgical procedures. So if someone is not happy with the way they look and they want to reconstruct the facial and jaw, which is very common in the Hollywood, they will go for facial and jaw reconstructive surgeries. Implants, bone grafting, sinus lifting procedures, any skeletal deformities for any syndrome the person is having, any craniofacial anomalies, any facial traumatic injuries, any facial pain, or TMJ is our temporomandibular joint. So this is a TMJ. So this is our skull. This is our temporal bone. This is our mandible bone. And the middle where they attach is called temporomandibular joint. So any disorders if happen, and you may have heard about it. You know, people open the mouth all the time and they hear the click sound. So sometimes it does. These problems, if it has to find a permanent solution, we need to see the oral and maxillofacial surgeon. Any head and neck cancer or micro neurosurgeries, any obstructive sleep apnea, facial aesthetic surgery, and dental and facial infection. And you see the reason why they just don't need to be a Bachelor of Dental Science. They have to have a medicine because they will be involving in a lot of surgeries. So there are following few services which is very common, like normal is dental implant surgeries, any outpatient anesthesia if they have to do that. They are very, very capable of anesthesia. Surgical correction of maxillofacial skeletal deformalities. If someone got an accident and they broke the, let's say, head bone, and then you have to remove it. After that, we need to construct it again. Cleft and craniofacial surgery, facial traumatic surgery, and facial and pale and TMJ and TMD surgery. In facial trauma surgery as well, I know oral maxillofacial surgeon who have actually reconstructed the artificial eye. That's also part of it. So it's a one step below plastic surgery, you can say, for face. Okay, now oral and medicine facial pain. So again, oral medicine profession expert diagnose and treat pathology and facial pain. So they don't do anything, but they are very good in diagnosis, any sleep disorders or any TMJ disorders. So majority of the time, the conditions they are doing mastery in oral complication of medical therapy, which is cancer treatment, is chemotherapy and radiation. Generally, chemotherapy and radiation is done in hospitals, but they will be very closely liaising with oral medical people. So this is oral medicine. If someone is suffering from oral and facial pain, jaw pain, mastectomy, or cervical mucoskeleton related pain, they will not go to the GP, they will not go to the higher specialist, but rather than they will go for oral medicine people. If there is any neurovascular pain, for example, migraine, cluster headache, or neuropathic pain, sleep disorders related to oral health and facial pain, this is very, very big. Sleep apnea, that can be really lethal in sleep. So for them, oral medicine, and they have to, again, refer to orthodontists to set up the sleep apnea appliance. Sleep disorder related to oral health and facial pain, any burning mouth syndrome or any kind of cancers, oral changes associated with systemic disease, salivary gland dysfunction and dry mouth, inflammatory condition including mucosal autoimmune disease, any viral, bacterial, and fungal infections, benign growth, diagnosis of oral cancers and precancerous lesions, any canker sores, bad breath, taste changes, or oral manifestation of HOI. So they are pretty much a doctor. If we have a serious concern about our oral health, if we see white patches, if bad breath is not going away, and if there is something abnormal you start seeing within yourself, then the right people is with the oral medicine people. You go there, they will sit with you, they will do the diagnosis, they will probably end up doing some biopsies, and then they will make a diagnosis. Because without right diagnosis, you're not going to get a proper treatment. You can go to general dentist, they can start giving a treatment, but end of the day, they are just relieving the symptoms only. But if you get hold of the right diagnosis, you are not curing the symptoms, but you're curing the disease at the same time, which is very important in oral health. Okay, the next one is orthodontics. Everyone must have heard about orthodontics. It's braces. So again, it provides comprehensive treatment for bite problems, any misaligned teeth and jaws, and jaw growth problem for children and adult in a modern age, open design clinic. It used to be very popular in young age people, but even now 40, 45, even 50 years old can go to orthodontics and start having the teeth. And orthodontic services are generally regular standard metal braces, clear braces, and self-ligating braces from the variety of established manufacturers and companies, and so that each treatment is specialized and tailored to each patient. Orthodontic treatment for children, including early treatment and growing guidance, which is very important, especially if you don't look after it at early stage, they can lead into skeletal deformities. Any orthodontic surgeries and cleft palate and palatal treatment. So what happened with cleft palate is there is a hole in the palate is very common in male childs, and all they have to do is create a special appliance so that it can fit, and it at the same time it is correcting the alignment of the teeth as well. Comprehensive adult, adolescents, and teen orthodontic treatment. The number one is aesthetic orthodontic treatment, a two-phase or mixed dentition treatment. So it's basically when there is a transition happening from deciduous to permanent teeth. So that time orthodontics is very important. And nowadays it's very popular. Invisible, which is clear aligner trays, including Invisalign. So Invisalign is the company. So you don't have to have the wire bracelets nowadays. You just put it, no one notices it, and it's just doing the purpose. All right, so now it's a periodontal and gum disease therapy. Like we discussed about it, it includes non-surgical and surgical as well. Advanced surgery, gum bone grafting, recession procedures, and dental implants, dental crown lengthening, and pockets. If we delay it for too long, especially men, we don't go to dentist. It end up you will start seeing your front. You start with the front lower tooth, it will start wobbling, so it will start having some movements. It could be grade 1, grade 2, grade 3, but you go to the dentist and they will be doing the bone grafting surgeries. They will be adding few calcium rich bone particles into your mandible so that it can be fixed. But if we start going it from day one, you don't have to go through that procedure. And I'm telling you, bone grafting is not a pleasant experience, and it's very expensive on your pocket. Okay, next one is prosthodontics and implant innovation. That's probably the last one. So restorative dental treatment can have a transformative impact on the lives of our patient because of the renewed confidence it provides. which can be achieved as follows. So prosthodontist is the one who gives dentures when we have old residents we have to look after. They are the one who going to give a bridge. And now you have seen is a lot of people don't want to go for ortho treatments and they think they're not going to wait for 2-3 years. So they will say, can you please fix my smile? All they have to do, they have to put crowns in the front so that it will all look good. And that's a permanent solution as well. They will do some guided restorative surgeries. Nowadays, there is a CAD and CAM scans. And of course, dental implants. So dental implants, orthodontists can do dental implants, prosthodontists can do dental implants, periodontists can do. Okay, so the most important part is I have threatened you guys a lot. What to do now?
Sorry, Litesh. If we can quickly wrap it up, please, for us.
This is the last slide.
Okay, thank you.
Okay, thanks. So to take the better care of your oral health, it is important to floss daily, brush your teeth with fluoride toothpaste twice daily, and visit your dentist at least twice a year. And there are some tips for a better dental health. So use a soft bristle to reach every area of your tooth. And of course, don't go for expensive brands. Otherwise, you will be feeling pain to throw it out. And you have to change it every 3 months. So replace your toothbrush every 3 months. And then choose a toothpaste which has a fluoride, because if you're choosing a fluoride, you are reducing a decay for 40%. Brush properly, make sure you are covering every bit of it, clean outside, inside, 45-degree angles, and floss properly. Floss is a very important thing, so gently insert it between the tooth and go for back and forward motion. Thank you.
Sorry, thank you so much, Litesh, for that. If anyone has any question, they can ask him now. Anyone? Okay, so I have a question. Okay, so I'm not sure if it's a myth or if it's actually the truth. So I've heard my mother and others talking about it. So cleaning of teeth, is it good or is it harmful, and does it weaken the teeth?
You're talking about professional cleaning?
Yes, please.
Yeah, of course it's a myth. It has nothing to do with the weakened teeth. So what happens is the white portion we see here, that's called enamel, and that's hardened. This is the hardest part in your body. So it's actually harder than the bone. So your dentist is not scratching the enamel part, like we said. Dentist is only removing the tartar. So it is nothing to do with it. It's actually healthy, completely myth.
Okay, thank you so much for today's session. Thank you so much. Thank you, everyone. And we are live streaming it on our YouTube channel. So if you want to go through the slides again, just have a recap, you can watch that. Thank you so much, everyone. We'll see you tomorrow then. Thank you, Litesh, once again. Thank you so much. Thank you.
Thank you, everyone.